Hello warriors, hello healers. Thank you for watching this video. Welcome back to our YouTube channel, or if you are listening to this on the podcast, welcome, welcome, welcome. Before I get started, I'm gonna say a few things. I will be triggering some people. Some people will be looking at this or listening to this. They will get triggered, they will get angry. You will have a flow of emotions. What I would love for you to do, I would love for you to create some space. If you feel like you're being triggered or you angry or you're upset or whatever thoughts that comes to your mind, I would love for you to pause this video or stop this podcast, like turn it off, walk away. But I also would love for you to come back to it because I think it is a very important topic that I need to discuss with you that many of us are not aware, and I need to discuss it with you. Not only is it gonna help you know what to expect when you work with a functional medicine doctor, but it's also going to help you discern if you want to put your money in a functional medicine clinic or if you want to, you know, continue doing whatever you're doing, or what you should be looking for before you invest. Okay. Now, I'm making this video because we got an email from a patient. And if you are the patient watching this video, I want to thank you. Thank you so much. This has nothing to do, with blaming you or being, like no. If one person has this question, I'm sure many people have this question. So that's the whole purpose we making this video, because again, I feel like when people hear functional medicine, they think about it differently. They don't really know what it involves. And also not only on the financial aspect of it, but the work that we do at functional medicine doctors and how us here in New Jersey, Wellness Corner NJ is the most cost-effective clinic. Okay. And many people get sticker shocked. So that's why I'm saying you should really watch this video or listen to this podcast, because we're going to talk about money. We're going to talk about what to look for, and we're going to talk about things that you can do while you are working on getting that money. Now, if you're new to me, you don't know who I am, this is your first exposure. My name is Dr. Jennifer Genty. I am a functional medicine doctor, holistic medicine doctor, integrative medicine doctor, natural medicine doctor. What do? I help my patients get rid of digestive issues naturally, get rid of hormonal imbalance naturally, lose weight naturally. I just help them, going from point A to point B. And our patients are unique. They are special, they are unique. I am not for everyone. My clinic is not for everyone. We do things that are completely different. We really, really love our patients. We really, really go above and beyond for our patients. And because of the way I want to help our patients or help people, we have a different structure here in our clinic. Okay. So again, we specialize in hormonal imbalance the natural way, autoimmune conditions the natural way, the gut issues, helping people eliminate gas, bloat, acid reflux, get off medications the natural way, and also lose weight, because losing weight is always an important factor on everybody's list. And I have a weight loss program that is the amazing. As a matter of fact, we just got off a detox program, and I have to tell you, everybody's loving the detox. People lost anywhere from 12 to 18 pounds in 3 weeks, 2.5 weeks, really. And we did so while they have energy, vitality, without giving, up all the things that they love, without, with the idea of exploring all the possibilities out there. So I know for sure our results are visible and we do great work here. So why am I filming this? Okay, so as we make some changes in our consultations and we make some changes in our follow-up, I hired another practitioner to help me, because I'm seeing there's a trend where people are not getting healthy in conventional medicine. People are not getting healthy. People calling us, contacting us, asking us if we can, do something for them and what they should be doing. So that's how this whole conversation comes. So we decreased our consultation rate. Our consultation rate used to be $450 for 2 office visits. So now it's $250. We're about to increase it to $260, really. $250 for 1 hour. And also the follow-up visit is $150. So people are still saving money. So what I want you to understand, what I want you to really take away from this on this video, take away from this, me talking to you about this, is the value, the work that we do. And I mentioned it at the beginning because many people are not aware how much work it takes for practitioners like myself, okay, to help patients get healthy. All right. So right now we see patients 2 days out of the week. And the reason why we're doing that, because the other days, like Mondays and Wednesdays, we are closed on Thursdays, and Fridays, Mondays and Wednesdays, we are managing cases. I have a lot of difficult, tough cases, cancer patients in my practice. They are doing well, autoimmune patients in my practice. So I need to create the time and space to really help my patients on a larger scale. Because when people give us money, they are paying for results, okay? My practice, my programs are result driven. That is why when people invest in us, we have different tier of investment depending on how much support or guidance they need. We still have one. So since we are studying and we're hearing from people, we have 3 tier right now in our practice, and people get to choose financially which one they can afford. All right, because my job is not to look in people's pocket, is to give them the recommendations that will benefit them. Because our patients will come to us after they've seen so many other doctors, after they've been on so many medications, after they've done so many other things, and they're not getting results, and then they come to us. So these patients send us a message, and in their sense of how we are taking care. I mean, we're taking advantage of sick people. I think that's how she verbalized it. I'm probably putting my own words, but like I mean, she's mentioned that because her package was $11,000, I think it was $11,000, because packages changes prices, and we are taking advantage of sick people. We are just like the other doctors out there. We are money hungry, and like a whole bunch of statements that are not true. And I understand, because people usually have exhausted their funds before they come to us, right? If they have money in the savings account or they have money somewhere, they already use a lot of that money before they come to us. And since functional medicine happens to be the last resort for a lot of people, they are expecting to have a different fee, right? So, which is not the case at all. A typical functional medicine package of the like a package like ours is in the $20,000. Yes, it's $20,000. So let me tell you how this whole started. I'm gonna take you on the patient journey from the minute they contacted us, right? Usually people go read our reviews. We have wonderful reviews, and all the people that give us reviews, they all paid money, because functional medicine is not a covered service. Although now we hire the company and we submit on our patient's behalf, right? We pay that company a lot of money every month. So on the other end, we are losing, right? Our patients pay $250, and then we do insurance verification, which we pay for. There's nothing free in America. And we also submit on their behalf, which we pay for. There's nothing free in America. So we are investing, because I want people to at least have the first or the second visit so that they can have an idea what the root causes are, or what pathogenic activities they have, or what the toxicity bundles are. Like, I want them to have some information, and then they can discern, or they can take that information and do whatever they want to do with it. Okay, so patients will find us on Google, schedule an appointment. Our consultation, the first 1 hour consultation, or 45 minutes to 1 hour consultation, is $250. As you can see on the screen, a typical functional medicine consultation is $460 per hour. Okay, we've always been the most cost-effective functional medicine office out there from the very beginning, right? So when people contacted us, we will send them forms to complete. There's an intake form they have to complete, because the more information they give us, the more we can help them. There's a 7-day food journal that they have to complete, because we want to give them some recommendations of things they can get started right away. And they also have to submit the current blood test. All right. So all this paperwork we have to review and evaluate before the patient comes to our clinic. Okay. So we take an hour of the time to study the paperwork, to evaluate the paperwork, because if you know anything about insurance, insurance will deny any blood test that has been done frequently, right? So we want to make sure that we are ordering different tests. If a patient has done a CBC or basic test done, and we cannot, if we have not reviewed, we cannot repeat the same test, the insurance will deny. And also the reason why we have them submit the blood test is because we also want to make sure that we are going over the test with them as well. You'll be amazed how many times patients will come to us and they have no idea that the liver is failing, the kidney is failing, or they have autoimmune conditions, like whatever. They have no idea. You'll be amazed. And most often I'm looking at the results. I'm like, did you know you have a cyst on your kidney? Nope, the doctor didn't tell me that. Okay, do you know that you have Hashimoto thyroiditis? Nope, the doctor. So we taking time to study not only the intake form, which is 9 pages, your 7-day food journal, and also the lab results from previous doctors, so that will better help us help you and formulate our next steps. And then you come in, we spend 45 minutes. Since we are doing work behind the scenes, we spend 45 minutes with you, sometimes an hour, depending on the severity of the case. And then we give you the LabCorp script or the hormone kit test or the toxicity bundle. So we give you those recommendations, and then you go have them done. While you have them done, we send you basic recommendations of things you should do. Okay, if I'm seeing something, for instance, I had a patient that was taking calcium, which I don't think anybody should be taking calcium, because calcium leaks into the tissue and that will lead to calcification. Okay, and if you look at the trends of cancer, a lot of cancer patients have calcification, kidney stones, calcification, oxalate. So I will give them specific recommendations right on the first visit, or we will send them recommendations after we document everything, after we look at the visit notes. We'll send them some recommendations within 48 hours. So you are getting something for the $250. I know it's terrible. I have to explain everything, how we break it down. You are getting something for the $250. And then when you come back for your follow-up visit, which is $150, again, we have to take an hour before you get to us, to our clinic, to study the results of the test that we prescribed, right? Like if it's the toxicity bundle, that's like an 18 pages. We're looking at your mold, your environmental toxicity, and also your heavy metal toxicity. And we have to highlight things, pinpoint things out to you, because again, it's new to you. We are helping you identify the root cause of your symptoms and your illnesses and your diseases. All right, that's another hour. And then when you come, we repeat the same process. We'll go over everything with you, your hormone, your cortisol levels, your estrogen, progesterone, DHEA, and then we'll go over the LabCorp, your gut infections, your Coxsackie, your cytomegalovirus, parvovirus, Epstein-Barr virus. So we spend time with you. Sometimes it's up to an hour 150. Okay? So if you look at all the work that we do before you sign the protocol, and you look at other people's pricing, like I have one on the screen, this is public knowledge, right? So you can Google these people, you're gonna see the same information. So I'm not outing them or blaming them or anything like that, okay? So you can see they have very transparency pricing, which I love. These people are charging $650 to see a nurse practitioner for 60 minutes. $650 for 60 minutes. That's just to see them for 60 minutes. There's no packages, there's no protocol, there's no recommendations, 60 minutes, okay? $895 to see this wonderful lady for 90 minutes, all right? So there's a deposit. So when I say functional medicine is cost effective, it is cost effective because again, we are helping you identify the root cause. We're giving you basic recommendations. We are customizing a plan for you. Now, once you are gone, what I do, I take another 30 minutes to go over your results again. I video it. That's something I started doing because I'm still training our nurse practitioner. She's new to functional medicine. I'm training her as I do the videos. I'm helping her recommending certain things. So I am behind the scenes mentoring someone that is amazing. She's lovely. She has so much patience. If you haven't met Deborah, she is. And she's going to be a great functional medicine practitioner. She is. She's not going to be. She is already. And people are going to see her more than see me because I have other very complex cases that I need to treat behind the scenes. I have people that hires me, pays me $25K, a lot of money, because they know I can get them results. They know they're hiring a private doctor. So if I want to help a lot of people, I need the help, right? Because Paris wasn't built by one person one day, right? Like the bridge wasn't built by one person. So when it comes to helping people get healthier, the functional medicine way, the natural medicine way, it requires other people to help me. So that's why we had in the practitioner. So after I record the video, right? If you're a patient of mine, you're a follow-up patient, you'll probably know what I'm talking about. And I think that's the video the person saw that got her very upset at me and telling me that I'm taking, advantage of sick people. I'm just like the other doctors. I'm pushing pills, which I just like the recommendation is strictly natural medicine, natural herbs. I don't do medications here. We don't do medications. We only prescribe as an emergency. So you will never see me prescribing a medication on my protocol. Now, what does the protocol entail? So we did the video going over the results again and send that over to the patient with the protocol. I also filmed and we cut the protocol. So you see all the work we do, all the work that we do. 250 is like 4 hours. 150 is like it's a lot of work. We do a lot of work. All right. So when I sent the customized, individualized, personalized protocol to the patients, I give them 3 options. 3 options now. And the level of, again, guidance, accountability, and support, the more guidance, accountability, and support one needs, the more that person's gonna pay. But at the end of the day, they are not paying anywhere close. I know when you look at the price, when they look at the price, they might be like, oh my gosh, it's a lot of money. Yes, because for us, you are paying for healing. When you pay attention. So that package that person's referring to is $11,000. I believe it's 4 to 6 months. But what do we get for $11,000? I'm very transparent with our prices, and I want you to be very honest with yourself, right? Like if you are in a phase or stage that you cannot afford $11,000, then do what you can do. Because at the end of the day, it's a lot of work. Everything's included. Everything's included. 6 one-on-one visit, right? If you were to take this, right, 650 times 6, let's do the math. If we were to take 650, just for I have my phone. 650 times 6, that's already $3,900, right? And then you have all the supplements included, all the supplements. So our protocols have different phases. Phase 1 is detox. Everybody detox. I include that into the protocol. That's like 650. The detox is 650. And then phase 0 is detox. So phase 1, we work on inflammation, immunity, concentration, energy, because we need to prep your body for phase 2 and 3. And phase 2, depending on what the root causes are, sometimes it's hormonal imbalance. We're seeing a lot of hormonal imbalance, peri, pre, and postmenopause. We're also seeing a lot of autoimmune conditions now. We're seeing a lot of mold toxicity, a lot of gut infection. So phase 2 might be on hormones or might be on, digestive issues. Like it depends. It depends on what is coming up in abundance, the results of the blood test. And then phase 3, we always go after pathogen, right? Because that's when your body's strong and that's when we can actually go and kill things, right? Kill, so to speak. Decrease your viral load, decrease your pathogenic load. That's what I mean by that. Decreasing the inflammation as well, and also helping your cells and your body and your organs and your tissue have room and time for them to recuperate. So $11,000. And the $11,000 is giving you a private doctor. When patients work with us, they don't need any other doctors. Why? Because we have an expert, functional medicine. I've been practicing functional medicine for 10 years now. And then we also have a conventional medicine practitioner as well. That she does fantastic work. So we will help you. We will guide you. We'll give you all of the things that you need, right? So we never charge our patients for communicating with us through Practice Better. Practice Better is a HIPAA compliant app that I use, and we check on our patients every Mondays. The tier 1 people, we check on them every Mondays because we want to make sure that they are getting results, they are on the right track, and we want to make sure that we are serving them at the highest level, right? We pay for results. So they get a message from me, a message from Mel, a message from Deborah. They get a message from us checking to see how, the weekend went, and whatever issues that's coming up, we have to fix that problem. Right now, I have a patient that having an autoimmune flare up, right? That's a patient that signed a protocol last year. Signed the protocol, and her protocol was $9,000. That was last year, right? And because of work, because of family issues, she's not able to really feel 100% because stress is so hard. So I'm helping her to stress. We never charge her, right? I'm not gonna say, hey, your protocol was for 4 months and it's like more than 4 months, we have to charge you again. No, because we agreed that we will get to a level of health and wellness where she can actually focus on maintenance. So yes, you're paying $11,000, $10,000, $13,000, but you have to look at the work that we're gonna do, right? We'll help you get off your medications. We'll help you build your immune system. We'll help you decrease inflammation. We'll help you balance your hormones. We'll help you get rid of your digestive issues, decrease your autoimmune flare-up. We help you feel better, and you're paying for a result. And we do all that without throwing a pill at you. I use herbs. We use herbs. I have to say we because I have another practitioner. We use herbs now in our protocols, right? As I mentioned, we always give people different options. So if you can do the tier 1 with all the supplements included, with all the support, we do daily check-in with our patients, weekly check-in with our patients. They have meal plans, recipes included. They have multiple things included, really. In phase 1, if that's what they can do, awesome. We also have phase 2, where they can just start with a few supplements and then they can add the office visit. They can add other supplements as they see fit. And then we have phase 3, where they have no office visits, right? That's 6,500 at the time I'm recording this. No office visits, and they get to work with Deborah, right? They don't get to have access to me because, again, it's not fair to the other people that are paying me a lot of money. That requires my brain space, my expertise, my time to really and to also help the other people. So it's not fair. It's not into integrity, right? Like I'm not gonna pay 25K knowing that somebody else is paying 6,500 and they're getting the same level of care. It is not fair. Okay. So 6,500 gets you a few supplements on each phases. You still get the detox, a few supplements in each phases, and then you can add supplements as you want. And there's no office visit, and you only get the meal plan. So there are different tier of really working with a functional medicine doctor. But functional medicine doctor, yes, many of us might look at it as it's very pricey, but what is the alternative, right? I ask my patients this all the time. What is the alternative? Sometimes we feel like we don't have the money, but we need to do this work. I usually ask my patients to really give it up to the universe. If that is something you are called to do and you have tried all the other things, nothing is working, you're frustrated with the doctors, or you're frustrated with the practitioners, you're frustrated of doctors telling you that something's wrong with you, it's in your head, prescribing a pill, prescribing Xanax, or whatever they're prescribing, and you want to invest in yourself because functional medicine is an investment, not an expense. It's $11,000, which we have payment plans, but $11,000 for results. If I know someone has a pill and I have a chronic illness and that person can give me the treatment, the protocol, that's gonna help me feel better and it's $20,000, trust me, if I don't have it, I will ask. That's me. Now, I'm not saying for you to do this. We all have our personal ways, the way we see things. I myself I finished with a coach that charged me $25,000 for 6 months. People are paying more than $11,000 on other things out there, right? People are paying more than $11,000, more than $13,000 on other things out there. If I had a patient who came to me the other day, so her protocol was $14,000, but there was a lot of work. It was a 6 to 9 months protocol. We have a lot of work to do, a lot of work. That protocol requires a lot of my time. Like we had to different phases. It was a lot. If I'm being, it was a lot. It's a lot of work on my part, right? And she said no. She said, I'm sorry, I couldn't afford it. Got home, her roof leaked. She had problem with her roof. And guess how much she had to pay for the roof? How much? I think it was $18,000 or something like that. It was more than what the protocol is. And guess what? She found the money. She found the money. After the roof, she had to fix her roof. Her plumbing went out. So within that time frame, within that 1 month, she ended up paying over 25K, over 30K between the plumbing, the roof people, and they have to do some electric stuff, a lot of things they have. So your body's like the house, right? The longer you wait, the more money you pay. So now I'm gonna tell you some things you should look for before you hire your functional medicine doctor. So the first thing you have to look for is what is the work they are putting in to help you. If you are working with a functional medicine doctor, they're not asking you to complete paperwork and they're not looking at your paperwork prior to coming in. They have no idea what you're coming in for, right? Like they wait for you to come in. It's like, hey, my name is Dr. Genty. How can I help you? Run. Because it requires a lot of work and people don't understand that Deborah, we do a lot of work. We looked at, imagine if we have 5 patients that day, we have 5 intake forms we have to look at before the patients come, right? We have, sometimes people will send us blood tests, like, documents from other hospitals, and we have to look at all that. Because what is the purpose of asking you to submit documents if we're not going to look at it, right? It's like wasting your time. We have to look at all that. So first, you have to make sure that that doctor is asking you to complete paperwork. Complete the paperwork and send it, right? They should also be asking you for current blood tests because, again, we don't want to repeat what was done before, right? Like you paying money, whether it's $250, $460, $400, it doesn't matter. We don't want to repeat the same thing. So you want to make sure that doctors actually doing the work, evaluating your paperwork. So when you come, you don't have to repeat yourself, repeat your story. You might have to, like do it to remind them, or they might ask my patients questions like, can you tell me again what happened this day? So again, to kind of make sure that we get we get in the gist of things, we get in the right information, but you shouldn't be repeating your whole story again. Not at all. If that's the case, then that's not a doctor for you. Okay. And you also have to make sure that doctors are doing necessary blood tests. And that's how we save our patients money. Functional medicine doctors can have you pay anywhere from $4,000 to $7,000 in blood tests. For us, it's a hormone panel kit, which is $260. You pay the company. We might do a toxicity bundle, which is very important. Every human being should do that. That's $460 again. You pay the company, and then LabCorp is covered by insurance. So we really put the time and the energy in making sure that people are not paying more they should pay, right? So you can take that thousands and few dollars and put that towards your care, right? And after that, we take time that we don't get paid for to work on your individualized protocol. That 150 follow-up doesn't pay us to spend that hour, to record the video, to send it to you, to customize the protocol, to go over the blood test again. That's $150. So we at the other end is losing money. But that's okay because I always feel like as long as I'm servicing the community, we're giving back to the community, I'm always going to get things, in threefold, right? Because so many people are getting sick. They are frustrated and it's going to get worse, if I'm being honest with you, because the medications are not working anymore. The medications are increasing the side effects, right? There's so many things happening out there that many of us are not aware of. Like you start with one medication, you start, 2, 3, 4, 5. Okay. So it's like $300 for 30 minutes. Look at those prices. And you still have to pay for customized tests, right? And these people in PA, again, it's just reference. When I tell people that, they're like, no, that's not true. So I had this on the screen to show you guys. We are the most cost effective. And these people, they are full. People come to them. The people come to them and they are literally helping a lot of people, right? So we help our patients. We are result-driven practice, no matter how much money you pay. Because I know people's health is priceless. You might look at this and be like, well, Dr. Jens is good for you. You're a doctor, you're rich. No, it's good for you because, but for the patient to say we're taking care of sick people. I mean, I just did a group detox People, many of them didn't even pay $650 because they're already in our world. All they have to do is purchase in the package and they get access to everything. I literally changed my schedule, me, not getting paid, to service these people on Zoom calls because that's what I wanted to do. To show them behind the scene of how I'm eating, to give them pointers. I created a video, a document for people that want to lose weight. They should be eating this, giving, like, these things are time consuming. I don't get paid. $650 for 1 minute, 1 hour, 60 minutes. Versus $650 for 3 weeks with weekly Zoom calls. Don't get paid. So what am I saying this? I'm not saying this to, again, I really thank the patient. I want to say thank you because I'm sure many of you guys have a lot of questions. Why is this so expensive? Are we the most expensive functional medicine doc? Which is not the case. We're not even close to being expensive for the amount of work and value that we do. We deliver to our patients, and our patients have access to us to practice better every day. I answer patients' questions all day long, giving them recommendations all day long. We have a given nature. I'm always giving people samples. I'm always giving people like, I'm trying things for our patients. So that really made me thinking. I'm like, okay, I don't have to do this video. I don't, but I'm doing this for you because I want you to really put in the back of your mind what to expect when you work with the functional medicine doctors, or what the price is out there. So that you get to choose, you get to decide if that's something you want to explore. If you are not ready for functional medicine right now, right? And you don't have the money, you don't know where you get, that's okay. That's okay. Nobody's blaming you, nobody's shaming you. That's okay. But there are things you can do as you are working on this. You can do a detox, right? Our roadmap is detox, decreasing inflammation, building your immune system, and then fight pathogens, right? So you can detox, whatever detox you can get on the internet, start with that. You can literally change your diet. That's why we send patients recommendations of things that should remove. You can change your food. There's so much you can do right now that can help you. Change your food. Whatever you're eating now is giving you the results. Look at your stress level. Look at your lifestyles. There's so many things you can do. Do you have to work with functional medicine doctor? I highly recommend it because spending time buying the supplements online, spending time seeing all these doctors, it adds up. It really adds up, right? If you go to your doctor's office and the doctor's charging you $200 follow-up visit, and it's been 10 years, 5 years, we've been struggling with this. And every time you go, it's $200. I'm just being modest, $200. And then you've seen that doctor at least 4 times that year. Okay. And then the medications, some of them are covered by insurance, some of them are not covered by insurance, or there's a copay, right? There's a fee for the medications, right? Add that up. But the most important fee that you really have to add up, or the most important cost, is the cost of you not getting well. You paying, although you're not paying money, but you're also paying of you feeling tired, exhausted, hormone imbalance, anxiety, you feeling foggy, lethargic, having the stomach that won't go away, having your colitis, this autoimmune, your joint pain, like the headaches and migraine, like the anxiety, the stress, you paying for it. It's not monetary, but you're paying for it. You're paying for it by the night, the sleepless night. You're paying for it because your symptoms are consuming you and you don't know what to do. And you've seen all the doctors, or you've seen all the practitioners, or you cannot afford this, you cannot afford that. You're paying for it. So this video is not to make you upset. This video is for you to see what you should expect. Because again, I haven't have the intention when people come to us, they think it's going to be a $500 thing, a $3,000 thing. No, $3,000 for 3 months? No. $6,000 for 3 months? No. It's a lot of work we do behind the scenes. When people hire us, they demand results. They expect that we're going to give them the information, give them the recommendations. We're going to actually help them target the symptoms so that they can feel better. So it's not just, here's my money, and then I'm just gonna, continue doing what no, it's work on our part, because again, functional medicine is in the name, is to help you restore the function of your body. And here at Wellness Corner NJ, we are the most cost-effective functional medicine that I know out there. And no, we're not taking advantage of sick people. We're not stealing people's money. We're not, whatever, the words are. Like, we practice with integrity. We spend a lot of time. $11,000, $13,000 package is a lot of work. Okay, a lot of work on our part, because again, we have to monitor you. We have to make sure that you have access to us. We have to make sure that we're thinking for you. We're thinking for your illness. We're thinking for how you're going to get results, and what to include, what not to include. We actually, and everything's included. It's not just $11,000 and nothing else is included. Everything's included. So when you watch this video, I want you to really, really sit with yourself and say, what am I paying for? Right? Because I know whatever you're paying for, you're going to get whatever you're paying for. The lower the cost of the package, the less care you're going to get. Right? Because I've seen that patients who left us, they went to the nearest functional medicine doctor, and they only get in supplements. And every time they have to see the doctor, they have to schedule a visit every time. Like, literally schedule a visit every time. And I'm like, what? Yeah. And sometimes they don't get a call back from the doctor. They call, they leave messages, they email, nothing. Or they get something from a coach. Okay. So what are you getting? Are you paying $13,000 and get the most care and get a doctor that's actually about you, about your results? Or are you paying $3,000 and get supplements and frustration and recommendation to stop eating gluten? Or you getting a meal plan with recipes? And when things are not working, you can send that message to the doctor and say, hey, I'm still having chronic fatigue. I'm still having, diarrhea, constipation. I'm still bloated. My acid reflux is not going away. Right? I'm still on this medication. So I want you to really think about what you're getting. Because at the end of the day, those numbers are just numbers, right? $11,000 are just numbers, because your health is priceless. You can start working. We usually ask patients to give us a deposit and start working. As you start working and you are working on the universe, you never know where the rest of the money will come. And I feel like sometimes patients don't trust themselves too. Right? They don't trust they're going to get the money. They don't trust themselves. Do what you can. You don't have to do the most expensive tier. You can do the cheapest one. You can actually go Google food, elimination diet. Do what you can. But know that whatever you're doing is the result, is the level of results you're going to get. The more you pay, the more result you get. The more you pay attention, the more you do the work. All right. So I needed to do this video because I'm sure many people have the same questions. And for us, I wanted to put it out there because when we compare our prices, we are not even close to what people are charging out there. If you find a price that's like $900 online or $1,000 online, what are you getting? What are you getting? Are we replacing medications with supplements? You don't need to pay a doctor or practice $1,000 for supplements. You can actually go on Google and get your $1,000 for supplements, right? Like, what are you getting? So thank you so much for watching this video. Thank you so much for listening to this podcast. I would love for you to share this so that when those that are interested in functional medicine will know what to expect, and they'll make the best educated decisions for them that will give them the results they are looking for. All right? I know for us, our patients get results. We always go above and beyond, even when people give us $15,000. Sometimes we work a year with people for $15,000 when it should have been 6 months, because life happens, or 9 months, life happens, things happen. We are patient, we pause, we will continue. We never penny pitch people. We never really force people to do anything. If you've been in my world, I will give you my recommendations. I will give you the things, you decide. Because my job is not to convince you, right? Because we do a lot of work behind the scenes that many people are not looking at, right? So I'll see you on our next video.